Hi, my name is Furqan Ahmed. I'm a Mededia Intern, and today I'll be talking about how to study for Step 3. This video is made under the mentorship of Dr. Tariq. This is my score, and this score is around the 92nd percentile. So the fact that you're on this video means that you have passed the previous step exams. So congratulations for that. Give a pat on your shoulder and let's move on to the last one. This, in my opinion, and others I've spoken to, is the hardest of the step exams. This is because the questions seem very vague and they can test on very random topics. But the preparation is not hard, and regardless, do not worry. 90% of IMGs pass this exam, so relax and just prepare as much as you can. So a little bit of introduction about this exam. Step 3 is a 2-day exam. Day 1 focuses on the foundations of independent principles, which is more like step 1. For example, you'd be tested on the basic principles, biostats, ethics, and abstracts and advertisements. The reason I have bolded biostats is because biostat is heavily tested on day 1, so prepare it very well, and I'll be repeating this point throughout the presentation. So day 1 consists of 6 blocks of 38 or 39 questions, and each block is an hour long, and you would have around 45 minutes of break. Day 2 consists of advanced clinical medicine, which is more like step 2. Example, you'd be tested on the next best step, the diagnostic test, and day 2 has 2 parts. The first part is you would have 6 blocks of 30 questions, and each block would be around 45 minutes. The second part, which is something unique to step 3, is the CCS cases. I'll talk more about it in the upcoming slides, but you'll have around 13 CCS cases, and they would be either 10 or 20 minutes each. So when to start preparing for step 3? Ideally as soon as possible after CK and when you get your ECFMG certification. But not an issue if this exam is given later, since this is not a requirement to start working as a resident. Some of the advantages of giving this exam early: well, first and foremost, since this exam has to be given now or later, why not just give it right now? If you do have the opportunity to give. Passing this exam is recommended for older grads and for people who might not have scored very well on step 1 and step 2. People do say that this exam can help in securing some interviews, and if a program issues H1 visa, step 3 is a requirement for that. How do you register for this exam? After you get the ECFMG certification, visit fsmb.org. Registration requires 1 online form and 1 certification of identity. CID needs to be signed by a notary, and you can do this online. Example, on notarycam.com or online notary US. I personally used online notary.us. It was cheaper than notarycam, and the appointments were easily available. This whole process can take around 5 business days after the submission of both forms and fee payment, both forms including the online form and the certification of identity. The fee is around $900. So we'll talk about the resources now. The resources, once again, for step 3, UWorld. The UWorld question bank and the CCS cases is a necessity. Some of the other resources which are highly recommended are the CK notes, the notes you made while preparing for CK, ccscases.com, first aid for some topics, for example, pharmacology, mechanism of action, microbiology, and also immunology. This is because these topics are tested on day one. So if you do have the time, do focus on it. And biostats. The reason I mentioned biostats separately is because, like I mentioned before, it is heavily tested. So somehow focus on biostats. You could either do it uh, by only doing the biostats in UWorld Step 3, or you could also do the biostats in UWorld Step 2, or the UWorld course that it provides. So I personally only did UWorld question bank and CCS cases, but I do recommend the other resources as well if you do have the time. The time needed to prepare. Well, like I said, the exam is hard, but the preparation is not that hard. So the time required could be anywhere from 1 month to 3 months. And I think this depends very strongly on how long ago you gave CK. So if you gave CK around more than 6 to 9 months, then try to prepare for this exam for more than a month. And if you gave your CK less than 3 months ago, then try to give this exam in a month. Now we'll talk more about the 2 days of step 3. For day 1, which is the foundation of principles, foundation of independent principles. Generally, UWorld is enough altogether. If you want to pass this exam, UWorld is generally enough. But like I said before, it's recommended to do first aid for a few topics since questions are heavy on these topics, such as pharmacology, mechanism of action, microbiology, immunology. Also focus on biostats. I'll keep on repeating this, but it is a very crucial point for step 3, day 1. Day 2 is advanced clinical medicine, which is, like I mentioned, 6 blocks similar to UWorld CK. UWorld step 3 is enough. I did that. But if you do have the CK notes and if you gave CK long ago, do review your CK notes as well. The 13 CCS cases, which are basically interactive cases. They are patient encounters in a clinical setting, but on your computer. You'd feel like you're dealing with a real patient, but you'd be on a computer. UWorld is enough to pass. I only did UWorld, but I very, 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 very strongly recommend doing ccscases.com. Now we'll talk a little bit more about CCS cases. This is entirely different from the other step exams. So please get used to it and used to its software. Cases can range from any subspecialties, for example, medicine, surgery, pediatrics, trauma, obgyn. Cases can be emergent or in office, basically non-emergent. Some of the tips for CCS that I would like to talk about are, first and foremost, there's lots of information online that you can use to prepare for CCS, but there is one specific guide that I really found it helpful, and I will put the link in the description. Some of the other general tips include, if you have a stable patient, do a physical exam first and then order the diagnostic tests. And let's say a patient comes to you in office, you can send them home after ordering the diagnostic test with a follow-up appointment to see the results of the test. So for example, you have a patient in office who comes up with, let's say, mild joint pain. So you do the tests required, you do your CBC, you do your joint aspiration, you do ESR, and then you would let the patient go home and come back a few days later to check the results and also for the management. For emergent cases, it's a different situation. The patient could be unstable, so first and foremost, stabilize the patient first. Focus on the ABCs, emergency orders before physical exams, and these orders could range from pulse oximetry, oxygen, intravenous access, and more depending on the actual case. For example, you have a patient who cannot breathe at all, who has some kind of poisoning, and naloxone is not fixing the issue, then you will have to ventilate the patient if the patient needs it. Some of the tips include reassure patient when the case is benign, and always consult even though you will not get the desired response in UL. So in UL, when you do consult, the UL does not give a very positive response, so we might feel that it's not important, but consulting is very important, so always consult whenever you can. For example, if you have a case with anaphylaxis, at the end of the case, do consult an immunologist. It is highly likely that most cases will end earlier than the allotted time, especially if you do everything right. So do not worry if a 20-minute case ends in 5 minutes. Also, a 20-minute case will have two sections. First, the 18 minutes of initial section where you do all the management, and once the case ends, you will have 2 minutes at the end of the case where you could add in orders. Use these 2 minutes for counseling, vaccinations, and preventive orders, which could be smoking cessation, limit alcohol intake, vaccination, and age-appropriate screening. Example: colonoscopy, mammogram, pap smear, DEXA scan. So these are a list of common orders that you can keep on your mind and use it when appropriate. The reason I've included this list is because up until now in step 1, in step 2, we passively chose the correct answer. We did not actively have to think anything. But in step 3, CCS cases, we have to actively manage the patient as a real encounter. So it's better to have these orders at the tip of your fingers so you can use it when you need it. You can pause the video and go through these and try to memorize those. Some other general tips for the exam. On day 1, there will be abstracts and advertisement questions in the blocks. I think all 6 blocks would have either an abstract or an advertisement. These are not very easy to solve with the given time, so please do those questions at the end of the blocks and not in sequence. These questions will eat your time. Since I mentioned this exam is hard, there is a very high possibility that you will have a very bad feeling about the exam after your day 1. Please do not let it bring you down for day 2, and know that this is a very common feeling, and only focus on what's ahead, which is your day 2. Nowadays, exam results come on the second Wednesday after your day 2. So for example, if your day 2 is on 8th of September, the results would come on 22nd of September, which is what happened with me. For CCS cases, do not forget to use the real NBME software and go through it very well so you are used to it. And I say this because the real software is a little different from what you have in ccscases.com and UWorld. So once you're done with the preparation in CCS cases and you will go through the real software, do the 6 cases they provide, and really go through it. For example, go through all the orders, just randomly put the orders and look at the orders so that you have it at the top of your mind. Lastly, good luck, never give up and never lose hope.